Good day, and welcome to this lesson on cardiovascular clinical pathophysiology. In the previous session, we looked at the core concepts in clinical pathophysiology. In this topic, we explained what inflammation means, which we said that inflammation is a protective response that helps the body remove harm, start, and repair. We also looked at the core inflammation mechanisms, which includes vasodilation, increased vascular permeability, recruitment of immune cells, and release of inflammatory mediators. Without wasting time, let's dive into the main lesson. By the end of this lesson, you will be able to describe how blood pressure and perfusion are maintained in the body, differentiate heart failure, shock, and acute coronary syndrome based on key features, interpret basic cardiovascular clinical data such as pulse quality, BP trends, and fluid status. Let's start the lesson by asking, how are blood pressure and perfusion maintained? The cardiovascular system maintains tissue perfusion by keeping blood flow, which is the cardiac output, and vascular tone, which is the systemic resistance, high enough to deliver oxygen. Perfusion depends heavily on something called cardiac output, or CO. The formula is simple. CO equals heart rate multiplied by stroke volume. Stroke volume is controlled by three important factors, often called the three levers of cardiac function. First is preload, the amount of blood filling the heart before it pumps. Second is afterload, the resistance the heart must pump against. Third is contractility, the strength of the heart muscle contraction. Blood pressure depends on both cardiac output and systemic vascular resistance. Its formula is blood pressure equals cardiac output multiplied by systemic vascular resistance. If cardiac output drops or systemic vascular resistance collapses, then perfusion falls to tissue hypoxia until organ dysfunction. Now, what do preload, afterload, and contractility mean clinically? First is preload, also known as filling. Preload is determined by venous return and circulating volume. However, preload becomes low in conditions such as hypovolemia, hemorrhage, and dehydration. Next is afterload. Afterload is the resistance the heart must pump against. High afterload commonly occurs in hypertension and vasoconstriction. This increases the workload on the heart. The third factor is contractility, or pump strength. When contractility is reduced, the heart cannot pump blood effectively. This occurs in conditions such as myocardial infarction, cardiomyopathy, and severe hypoxia. Please note, cardiac output can fall if preload, afterload, or contractility fails, even when blood pressure still appears normal early on. Now, how do we differentiate heart failure, shock, and acute coronary syndrome? Let's start with heart failure. Heart failure occurs when the heart's pumping ability cannot meet the body's demands. The core problem is reduced effective cardiac output, often with congestion. Patients may present with fatigue, reduced tolerance, and possible fluid overload signs from the cardiogenic section. Next is shock. Shock is fundamentally a problem of perfusion failure. The core issue is inadequate tissue perfusion and oxygen delivery. Shock is not defined by blood pressure alone. Hypotension is often a late sign. The shared pathway in shock is reduced perfusion, leading to tissue hypoxia, then organ dysfunction. It often shows rising lactate, anaerobic metabolism. Finally, let's discuss acute coronary syndrome. The core problem is myocardial oxygen supply-demand mismatch. Patients commonly present with chest pain or equivalents. This can trigger pump failure, arrhythmias, or shock. In summary, heart failure happens when the heart cannot pump enough blood to meet the body's needs. This can cause fatigue, shortness of breath, and fluid buildup. Shock happens when the body is not getting enough blood flow and oxygen. Organs begin to suffer because tissues are not being perfused properly. Low blood pressure may happen late, so a patient can be in shock even before BP drops. That is it for now. We shall continue the lesson in the next video. Thanks for watching. See you in the next lesson.